Yeah.
So what are the common reasons besides pregnancy, or maybe that's the most common, that people will do a tummy tuck?
So anyone with significant weight gain, weight loss. So I have a lot of patients that have undergone gastric sleeve or those types of, and they'll lose 100 pounds. And so then they're left with all that excess skin. And pregnancy is kind of the same, big weight gain, weight loss. And then for those patients, I'll have to look at their arms, their thighs, sometimes their neck, because they've lost all this significant weight. So we have to address the skin that's left over.
Wow.
Ballpark, how many of these types of surgeries do you think you've done in your career?
Wow.
Gosh, I've done over 10,000 procedures, over 20 years.
Oh my God.
But I do like a tummy tuck or a mommy makeover at least like 1 or 2 a week.
Really?
So
Wow.
probably my most common procedure per se. Yeah.
Okay.
Yeah.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts.
We're talking about tummy tucks. Yeah.
And the reason I'm excited about it, I should take a step back. I was
Sure.
not excited in the beginning
Yeah.
to have this. But now that I've sort of like wrapped my mind around the fact that I have to with this hernia / diastasis recti / all of these C-section hang, all these things happening because of my ginormous babies. Then
3 of them.
3 of them. Once I wrapped my head around like the necessity, it made me excited about having a solution.
Right.
You know what I
right,
mean?
right. Well, I think from the outside looking in, especially for people who have not had kids, who have not gone through something as major as a pregnancy, like a full-term pregnancy, and how that changes your body, you don't really understand the necessity to restore yourself, right? A lot of people, I feel like, put the stigma around it because they're like, oh, she's so vain. Like, you can't expect your body to be the same. Or the other school of thought, oh, don't you just snap back?
Oh, I know.
I cannot stand that.
I
Snap
know.
back.
It doesn't even
It doesn't work
probably
like that.
even you did not just snap
No,
back.
it took some work, but you can only do so much work. And you had a whole career as a personal trainer, and you can target certain areas, but you can only do so much.
Absolutely.
Sometimes you need medical intervention.
Yeah, exactly. And so I'm really excited to have my free consultation today.
Oh yes, we're going to get it. If you don't ask the questions, I certainly will
Thank
ask for
you.
you. Yes.
And we are talking to
Dr. Edward Park. I mean, who better to have than Dr. Edward Park? Dr. Edward Park honed his skills and expertise in plastic and reconstructive surgery at Stanford University, starting as an intern and then working his way up to chief resident.
Wow. And at Stanford, he also conducted groundbreaking research in wound healing and stem cell research, earning him a prestigious national research grant from the Plastic Surgery Educational Foundation.
Dr. Park is also a board-certified plastic surgeon recognized by the American Board of Plastic Surgery and the American Society of Plastic Surgery. That is major.
Yeah, that's important.
Yeah, it is.
Yeah, and he is the owner of Face and Body Cosmetic Surgery in Upland, California.
So what you're saying is we're about to do your consultation for you, and
I'm ready for it.
Yeah, I mean, and you know what? I feel like our audience is also ready for it because let's just go ahead and take the stigma away today.
Yeah.
Let's ask the questions. Let's get informed.
We're going to do it for you guys.
There you go, and let's make the decisions. Well, you've already decided it's happening.
It's happening.
Dr. Park, do you have any availability? Actually, I guess we should get him in here to talk to this afternoon. Can you fit me in this afternoon, Dr. Park? Let's bring him in here, Dr. Edward Park.
Yes.
Let's talk about it.
Hello, Dr. Park.
Dr. Park in the house.
We're so happy to have you here.
Get your fashion together. I see you over there. Make sure everybody can see those beautiful bracelets. For those of you who are just listening and aren't watching us right now,
Yes.
Dr. Park is very fashionable and has
Head
some
to toe.
beautiful bracelets that were made by one of his kids.
Yeah.
So, Dr. Park, you are a board-certified plastic surgeon, right?
Yes.
And you work with your wife, which I think is so cool.
How do you work with your wife? Tell us
Well,
about
we just identify who the boss is,
And who is that
which
boss?
is her.
Oh,
Okay.
okay, that's the right
I
answer.
learned.
That's the
I
right
learned,
answer. Okay.
Yeah.
Yes.
Yeah.
So tell us
You're a
about your
smart
practice, though.
Yeah. So, so my practice is faceandbody.com, and we are located in Upland, California. And I have my own surgery center, a medical spa. So we offer all lines of treatment, everything from I operate on the face, do facelifts and eyelid lifts. I do a lot of specialized breast surgery and reconstructive revisions. And one of my primary focuses is expertise is contoured abdominoplasty, which is the tummy tuck.
Tummy tuck. I need this.
Yeah, special techniques on it.
Yes.
And what made you decide to go the route of plastic surgery?
So I love the creativity of plastic surgery. We operate all over the body. And once again, going from face to body everywhere. I love the creative aspect of, building Legos and model airplanes as a child and being able to do that now on human bodies a little bit more seriously. Yes. But there's a lot of creativity, which I love in plastic surgery, like sculpting.
Mm-hmm. And precision.
Yeah.
Precision is key.
You have to be very precise.
You're an artist and a scientist.
At the same time.
I always say kindergarten is the most important part where you got to color in the lines.
Yes.
So,
what's your area of specialty or your signature surgery, if there is one?
I basically kind of patented and really tried to perfect the abdominoplasty, and I call it a contoured abdominoplasty. And when you're contouring, as you're doing in makeup, I'm trying to really get the shape back, really like an hourglass shape back, because every mom, we were talking about this earlier, goes through the stretching of the muscles in the skin. So there are several layers that I have to sculpt. But I'm very aggressive in my abdominoplasty approach to really kind of get that hourglass figure back. So that's kind of my number one.
Amazing. I bet you've made a lot of moms really happy.
I hope so. Yeah. But I was saying earlier, I think every mom deserves it. The sacrifice that you guys go through, both in the physical nature of delivering and of course emotionally to your families and such. So it's rewarding.
Let's talk about that emotional component for sure, because a lot of times people aren't just motivated to have plastic surgery because they just want to look good. It's because they want to feel good inside their bodies and inside their minds. How does that factor into the work you do?
Yeah, I think that's kind of the most important thing. People think, just like you mentioned, it's superficial and trying to look better. But I think that emotional, mental component is by far more important. The confidence, the self-esteem. You mentioned a lot of moms will come in, and a lot of my patients are mothers, and they'll come in almost feeling a bit guilty of like, gosh, I don't know if I should be doing my tummy.
Why am I putting this before my kids? I have to lay low for a few months. Yeah.
Exactly. And that's what I just admire about all moms. And that's the very first thing I do, not in just tell them, but say, you really deserve this. You have sacrificed tremendously for your family, your kids, your husband, and oftentimes moms are always putting themselves at the bottom. So it's like a privilege for me to go on this journey with them, and once they've made that step to say, hey, I want to really take care of myself. So
it's life-changing.
Absolutely.
And when you can put yourself first in that way, it's like the airplane analogy, right? Like put your safety mask on first and then you can really show up for everyone else, kind of thing.
It's like love too. If you don't love yourself, how are you going to love others? So I think it's important.
Tell us more about the tummy tuck. Let's start with that. That you said that is your favorite thing to do or your special?
It is.
Okay.
It is. I love the tummy tuck. I have termed and kind of trademarking what's called a contoured abdominoplasty.
Oh.
So
what does that mean?
Yeah, what's the difference?
Yeah. I have some special techniques whereby, when you're contouring the face and you're making the shapes and shadows come out, contouring the abdomen, in my mind, is really getting an hourglass figure back. So #snatched that waist. I have a lot of patients that tell me that, say, I want a snatched waist.
Wow.
So, and what that entails, really the most important part, you've kind of talked about where the rectus muscles can diastase or separate.
Yes.
And what I'm trying to do is corset them back together again to really retain that hourglass shape. So, for example, in the 1920s, when they were like cinching
corsets.
Yeah, with corsets,
exactly.
I am doing an internal corsetting of the muscles. Yeah.
So that's what I have a hernia, a ventricle. It's my 4th hernia.
Wow.
Yeah. And the last time my doctor went in, he said, your abdominal wall looks like Swiss cheese. and you need to have a tummy tuck, you're going to keep getting hernias.
Yeah.
And sure enough, a month later, I had a surprise pregnancy and it popped right back out.
Oh, wow.
And now it's very bad.
Okay.
And on top of that, my DR, my diastasis recti.
Yes.
How do you
That's
say
right.
it? Okay.
Both ways.
Potato.
Yeah.
So he was like, you have to do this. We can do the hernia at the same time. Is that correct?
That's correct.
Okay.
Yes. And that's what's really important about plastic surgery training is that we also train in general surgery as well. So normally you go to a general surgeon to repair a hernia. Well, since we have that training background and you come to me with a hernia, I can repair that and do the muscle plication at the same time. So we're going to do like a double repair of your abdomen to fix the hernia and make you stronger and give you your shape back.
Oh, and snatch that waist, girl.
Snatch that waist.
She snatched that waist. But she was a personal trainer. That was her love. That was her passion. And now she's limited in what she can even do. You can help restore that?
Absolutely. So you were talking about like your core strength. How do you feel now?
Oh, it's completely weak, which is so sad. Like you said, like I was so used to doing all these planks and workouts and
crunches, any of the things.
HIIT training, and it's like
You're
I'm
limited
injured.
now.
I can't do any of
It's
that.
an injury for sure.
Push-ups on my knees, what? You know.
I mean, in line with restoring, your physical strength. What would it do for you? I know I'm interviewing you, and he's our expert.
Yeah,
but no,
I love it.
What would it do for you to be able to have it restored to what it was before and be snatched back together?
Well,
I tell people that, it's in the marriage contract in fine print that you are getting a tummy tuck in the future after kids. You deserve it. Because every mother, every single pregnancy will have a rectus diastasis, 100%. Now, if you're genetically, 100%. But if you're genetically blessed, it'll go back together maybe on the first pregnancy. But you've had 3, if you have 3 or 4, you're going to have a separation no matter what.
It's just inevitable.
It's inevitable. You can't fix it with sit-ups. You can't fix it with exercise. So I need to go in and corset and bring those muscles back together again.
Yeah, because it's split, especially if you have C-sections, right?
Correct. And that's cutting your muscles horizontally too. So that's
double whammy.
Is that where
Double
that
whammy.
abdominal shelf comes
Yeah,
from?
that's where the skin
I have that
starts.
too.
So we're going to fix
got it
all
all.
that. We're
Okay.
going to fix all that.
I've heard there's a difference between a tummy tuck and a mini tummy tuck. Can you explain the differences, please?
Really good question.
Great.
So in simplest terms, a mini tummy tuck is only going to provide correction up to the lower abdomen.
Okay.
So we're only going up to the belly button, stopping, and then pulling the skin down.
Oh.
Whereas a full tummy tuck, we're going to go all the way and raise the skin up to the ribs so we can repair the muscles and pull down maximal skin.
Wow. What would be someone's decision process on which to do, or what would you recommend?
Normally, I guide someone that is a candidate for a mini tummy tuck only if their upper abdomen, which is above their belly button, looks good and they're happy with it.
Okay.
So if they were blessed where the muscles are still tight and they don't have loose skin above their belly button, we can potentially do a mini tummy tuck.
Okay, and then do you do liposuction with that tummy tuck?
Absolutely. Good question. However, I'm not going to lipo the skin in front because we're already lifting and pulling, so the blood supply is tenuous. But I will do liposuction on the flanks, the hips, side breast, upper back, almost like a 360 approach.
Is that the contouring?
That's part of the contouring.
Okay.
Yeah. And then plicating the muscles together, that's further contouring. But one of my special techniques, if you go to a tummy tuck surgeon, is you normally will have drains, right? And people hate drains. I do what's called a no pain, no drain technique. So I don't use drains in a lot of my patients. And the way I do that is when the skin is laid back down on the muscle, I'll do quilting sutures, like a blanket, to eliminate any space for fluid and therefore no drains.
And there's not as much pain that way?
And then I'm injecting long-lasting pain medication into the muscles.
Oh.
And that's going to really alleviate. So my patients come in the next day walking, usually feeling pretty good and a much quicker recovery.
Oh,
What does that recovery process look like? I
Thank
know,
you.
because I know you're super interested in this, so I want to
Yeah.
get as much information out of our
Thank
expert
you.
while he's here.
So I try to keep it simple. I call it the 2-4-6 week rule. So at 2 weeks, we'll call it 10 to 14 days, you should be able to drive, do light errands, go to the market, etc. At 4 weeks, I let my patients do light cardio. And then 6 weeks, hit the gym, pretty much full except sit up.
That's like nothing, because with the
pretty good.
hernia surgery, I couldn't work out for 8 weeks.
Yeah, normally it's
And
6 to
C-section
8 weeks
too.
for
8 weeks for me, C-section.
C-section,
8
yeah.
weeks for sure.
Yeah.
I know.
So
Wow.
6 weeks, let's hit the gym.
Yes. By the
Let's
way,
go.
this is a similar question or a similar subject to tummy tucks, but I've heard you can do a mini tummy tuck with a C-section. Is that true? Are you going to myth bust for us?
At a C-section, I generally would not do that myself because your body has to go through that reversal process, losing the weight, etc.
And the uterus shrinking and
The
everything.
uterus shrinking,
yeah,
all of that.
feels
So
dangerous.
you could take a little bit of skin, but I have combined a hysterectomy with a tummy tuck. So
really?
A lot of plastic surgeons, we will combine with another surgeon, let's say OB-GYN. Sometimes we'll do ENT combinations. So we work with everyone. We're team
incredible.
players.
Yeah.
On your YouTube channel that you have with your wife, you two as a power couple, do you share like before and afters with patients' consent so people can have a better idea or better understanding, a visual understanding of what that process looks like before and after?
Yeah, we do on our website on
Oh, okay.
faceandbody.com. The YouTube channel, my wife and I are just trying to be real with issues, and she'll talk a lot about her recovery. She's gone through, interestingly, here's a fact. She went through a mini tuck.
Okay.
And then years later, she saw a little bit of bulge she wanted on the upper abdomen. So we converted to a full tummy tuck.
Oh, wow.
So that can happen as well. We want to make sure we meet your expectations the first time.
Did she wait till after she was done having the kids? And is that what you recommend?
She did.
Okay.
Yeah.
So definitely wait till you're done having
Done.
You know you're
Done.
done.
I've had a few, I'd say 3, maybe 4 people have children afterwards.
Surprises.
Surprise! And everything was healthy and good with the baby.
Okay.
And interestingly, most of them, the muscles went back to normal flatness,
Really?
just a little bit of loose skin,
Okay.
which is interesting.
So, what are the common reasons besides pregnancy, or maybe that's the most common, that people will do a tummy tuck?
So anyone with significant weight gain, weight loss. So I have a lot of patients that have undergone gastric sleeve or those types of, and they'll lose 100 pounds. And so then they're left with all that excess skin. And pregnancy is kind of the same, big weight gain, weight loss. And then for those patients, I'll have to look at their arms, their thighs, sometimes their neck, because they've lost all this significant weight. So we have to address the skin that's left over.
Wow.
Ballpark, how many of these types of surgeries do you think you've done in your career?
Wow.
Gosh, I've done over 10,000 procedures,
Wow.
over 20 years.
Oh my God.
But I do like a tummy tuck or a mommy makeover at least like 1 or 2 a week.
Really?
So
Wow.
probably my most common procedure per se. Yeah.
Okay.
Yeah.
There seems to be more of a relaxing towards, you know what? It's becoming more acceptable.
Yes,
And
there's
people
a
are
stigma.
talking. Yeah, people are talking about it more now.
Mhm.
Why do you think it's necessary for us to become more comfortable with the idea of changing our bodies if we elect to do so?
Mhm.
Right.
Especially after having kids.
Yeah. Yeah, and that's an important point. What I think and why I like the contoured abdominoplasty is because most of it is giving back to moms. And moms, as we know, you all are moms and you sacrifice everything for your kids, your family, your husband, and you guys often put yourself kind of lower on the priority list. So when a mom comes through the door, I just feel super thankful and I tell them, look, you deserve this.
Yeah.
This is not vanity. This is getting not only your physical strength back, but as you mentioned, confidence, self-esteem, fitting into clothing well.
All of it.
Yeah, all of it is
Well,
super
and
important.
you want to show up for the people you love in a way that makes you feel good and
Yeah.
happy, whether it's your spouse, your kids, your work,
Yeah.
everything.
Yeah.
It's so true.
You got to love yourself. Do we not
sure.
all, right?
Yes.
Yeah.
Love yourself, love your body, and in turn, you're going to love cup overfloweth, love to others.
That's right.
So
That's very true. Well, and what about, so I have a huge C-section scar because of the first 2 C-sections.
Yeah.
Can you eliminate that with the tub?
Absolutely. So this is a...
You're already ready for it. She's like, let's do this.
We're doing the consult right now.
Right here.
This table, we can just... scalpel.
Prep the arm.
Zoom in.
But that's a very common thing I see is C-section, extra skin over it.
Yep.
Yeah.
And we've got that flap. So what I do to eliminate it is normally the C-section scar is too high. And then so I'm going to go lower. The very important key is to have a very low scar. I want you to wear the lowest bikini or lowest whatever that it is hidden.
Okay.
And that's very important. Some surgeons go a little bit too high and it can't be hidden.
Yeah.
So once we go low enough, everything above it, including the old scar, the extra skin, will all be removed.
Wow.
Yeah.
So do you move where the belly button is then?
Good question. So if I can explain this correctly through diagram, let's say the belly button, what I do is I incise around it and free it.
Okay.
So then the skin is lifted and the belly button stays attached to the muscle wall. And then when we pull the skin down, a new opening lands onto your belly button.
Whoa.
So we don't detach the belly button normally. We just make a new opening for it. But it's super important that that belly button scar is hidden. And I often see too big of a belly button. We don't want that. So it has to be precise.
Wow.
Yeah.
That's fascinating. The other question I have with lipo, if you were not to go back to a healthy eating lifestyle, for example, I saw a lot of my clients when I was a trainer, they would get liposuction.
Yeah.
They wouldn't clean up their diet.
Quick fix.
Quick fix.
Yeah.
Come back.
Exactly. And then the fat, because those little houses for the fat weren't there anymore, so they would go into the houses in the arm,
100%.
right? Okay.
You are correct.
So that was true.
Yeah.
that I was seeing.
People do ask, will the fat come back? Fat can go back. There's still some cells there, but usually, yes, it'll start going into other areas. So we want to maintain your good results, diet and exercise.
So you're talking about results. I'm so glad you brought that up. People in our society now are used to instant gratification. This is not an overnight kind of change that people are going to see. What does the timeline look like if you are getting this full
Mommy makeover.
What does that look like until you're really seeing final results, and how patient does a patient need to be?
Yeah.
You probably hit the most important value that people need is to have patience, because we don't see instant results. As a matter of fact, a lot of what I do, I say, if you look great the first day or week, we haven't done a good job. Because a lot of things happen. For example, let's say we put implants in, they're too high in the beginning, they need to settle and drop. So we need time, the fourth dimension, to make sure it looks good at 3 to 6 months. Okay. So normally I'll take pictures post-op at 6 months, but that's not even when the full healing is done. Usually it's a full year. Wow. Yeah, things like scar and swelling take a full year, if not longer.
Well, and I've heard, one friend, she said her surgeon didn't pull the abdomen wall tight enough, whereas her sister, he pulled it so she was like hunched over for a while, but now she looks amazing.
Yeah.
Is that true? Yeah.
It can be. Everyone is different in terms of the surgical results as far as like how much they pull. I tend to be aggressive where it's safe. So I want that hourglass shape. So I'm pretty aggressive with the muscle pull together. But it's important not to pull the skin too tight, because then you can have skin healing issues, etc.
Oh.
So we want to be careful.
But you do want to pull it tight so that you get that look you want.
Right.
Taut. I would say taut. You want to pull it taut. Yes.
Yes.
I'm just going to assume that you're going to have this mommy makeover.
Yes.
What would you tell her and other women out there who are listening how to maximize as a patient what they can do to achieve the best results?
Great question.
So the 2 most common things that I have to discuss with a patient, of course, is number 1, be on your tip-top health, diet and exercise. But the second most challenging thing is, where's your weight? So I'll have some patients come in that are a little bit overweight, and to maximize their results, I say, hey, let's make a plan, give you 3 to 6 months to get you to your goal weight.
First.
Before the surgery.
That's a priority.
Let's say I tighten the muscles, pull the skin, and you lose more weight, 30 pounds after. Well, guess what? Things are going to look loose again.
Yeah. Well, what if you were to gain weight after the surgery? I mean, I know we talked about fat, but it doesn't cause the abdomen to split again?
Pretty rare. I've seen people that have gained weight and they come back and we go, your tummy looks great, but
your arms and everything.
Yeah,
Oh gosh,
suspense everywhere else.
That would be horrible.
Yeah.
Yeah, you just ruined that whole procedure.
You don't want to do that. No.
No. So you want to lose as much weight as you can.
You want to get to your goal weight so
Okay.
you can get the best result.
That makes sense.
For sure.
Definitely.
And then, of course, following a good diet and exercise plan.
And
moving
maintaining
forward,
that
and maintaining
afterwards,
it.
too.
Yeah,
I
it's
know
a lifestyle change. It's not just like a quick,
change.
I'm going to lose 30 pounds and
Yeah.
then go back to eat my burgers and fries every
Right.
single day.
No,
right?
I
Can't
love
do that.
burgers, but let's kind of cut that.
Lay off
yeah,
of those.
yeah. Well, especially if your goal is to not have the fat return in other places.
Yeah.
That part.
Nobody would have that goal.
Yeah.
Yeah.
We don't want that.
Definitely.
Are there any special care instructions for after surgery that someone would need to follow?
Yeah, my nurses are really good at going over explicit details, but we do generally want the patient bent a little bit. So some patients will get like a recliner, and if they don't want to go that far, to keep a little bit bent at the waist, 2 pillows under the back, 2 under the knees, just to stay bent for about the first week.
Why is that? Just to keep the muscle tight?
Yeah, because you remember we kind of pulled the skin. You were talking about being hunched over a little bit. So there's a natural tendency to do that. And by a week, you're standing upright and you're doing pretty good.
Are you wearing like special contraptions or anything? The reason I'm asking that is because I don't know about you, but after I had my C-section, there was like a binding kind of thing because I felt like I couldn't stand upright. And but once I put that on, it's like, oh, okay, because I needed the support.
Yeah.
The binder's key, and similar to the C-section, you're in an abdominal binder as well.
Wow.
You do wear that or some type of compression for about 4 to 6 weeks. It's just removable Velcro. Another quick tip is because you're hunched over, your back muscles tighten up.
Yes.
So I always tell people for that first week, a heating pad, your spouse massaging your back
masseuse every day. Come on.
Get those muscles loosened up.
Yes, absolutely.
Yeah, for sure.
Can you do too many abdominal surgeries? Like me, for example, I've had 3 hernia surgeries, 2 C-sections. Is it still an okay idea to do a tummy tuck?
It depends. Again, I would want to look at maybe some of the operative notes to see what they did, if they used mesh, and how complicated it got. But in general, I'm usually able to correct that on top, do the muscle plication. I've had a lot of patients with hernias, and they generally do pretty well.
The mesh and everything.
Yeah.
Oh, that's good to know.
How long will a procedure like that take? The surgeries itself, like if you're having to repair the hernia first and you're having to do everything else, how many hours are we talking?
So every surgeon's going to be different, but since this is kind of an expert area, I've got it dialed down to anywhere from about 90 minutes to 2 hours for a full tummy tuck, including liposuction to the flanks. Oftentimes, I'm combining that with some type of a breast surgery. We call that a mommy makeover.
Like the lift or the implant.
Exactly. Either one, a lift or an implant, because a mother goes through such physiologic changes, breast and tummy. So mommy makeover usually addresses both.
Okay.
And then I want to do things safely. I don't want to operate more than 6 hours because risks increase. So generally all my mommy makeovers are anywhere from about 3, 4, maybe 5 hours.
Okay.
We've completed the whole reconstruction there.
Is it a good idea to wait till your kids are a little bit older so you don't have to lift the baby, for example? Okay.
I get mothers of all ages. I think it comes down to like the support you have at home.
For sure.
If you got a family member, a husband that can really take care of the little ones, because to your point, you can't really lift for your baby for about 2 weeks. You can hold the baby, but I always talk about the transfers, which are the cribs and the car seats.
The car seat, yep.
You can't do those for a couple weeks.
Yes, that makes sense.
And that happens multiple times a day.
Exactly. Do men get tummy tucks, or how often do they?
They do.
They do. Okay.
Obviously not after having babies,
Right.
but they do go through some significant weight loss.
Oh,
Similar idea. Let's
the
say
gastric bypass.
or they've even worked off and lost 80 pounds.
Yeah.
Everything's gone down except that loose skin and even some separation of the muscles. So
Right. Because
some men will go through that.
These kinds of elective procedures, Dr. Park, are considerable. They're expensive, right?
Yeah.
Give me a ballpark for someone like in Selah's case. How much would it cost to get her restored?
Again, everyone's different. In my geographic location, I would say a tummy tuck ranges anywhere from about 14 to 20,000.
Okay.
That's everything included: anesthesia, facility care, all of that.
It includes the facility care
Everything,
afterwards.
yeah,
Okay.
is included. I always say, once you're a patient of mine, we're always going to take care of you, even if it's 2 years out and you need something done. We will take care of you. But yeah,
But
Does insurance cover
that's
something
what I was
like
going to
that?
ask.
the only time I've seen insurance cover a tummy tuck procedure is when there's been significant weight loss, and it's a little bit different. They'll call it a paniculectomy. What that means is all that extra skin, which is causing perhaps rashes, and skin irritation. So they need photos. Insurance companies need that, and they only allow resection of the skin.
Okay.
So what it's missing, the insurance will not cover it, is the muscle correction, which is the most important part.
So maybe in my case, they'd cover the hernia part, or
They
I
might
don't know.
cover the
They
hernia
might cover
part.
that.
Yeah,
But
those-
they wouldn't cover the muscle.
Correct.
So what do you do in those cases when you come across a mom who really needs all of the procedures, but insurance is only going to cover part of it? How do they subsidize the rest?
Well, a lot of them will finance. In fact, most of my patients do finance.
They use the CareCredit credit card.
CareCredit's wonderful.
Are there any other alternative procedures or treatments that you could have similar results with? Or is it... No.
For the tummy
His face
tuck?
was like,
I know. I saw he took
know,
that
yeah,
deep
for the
dive.
tummy
Like,
tuck.
eh.
Here's the thing. If let's say there's a young person, they have great skin, and it's only kind of the fat bulge they want, then liposuction's a great option.
okay.
We even have non-invasive. Let's say a male comes in, he just has a tiny bit of fat. We have CoolSculpting, which
Okay.
is a non-invasive machine that freezes the fat. So it just kind of all depends on what they're coming in with.
But if you have that loose skin from pregnancy, from weight loss, then you really have to just cut it out.
Yeah. It's the skin that's kind of the determining factor.
I see.
You're right.
Okay.
With CoolSculpting, you mentioned freezing the fat. Does it stay frozen or does it thaw out eventually?
Exactly. It's kind of a freeze and thaw out. So
Oh.
once the machine, the applicator in the area is for 30 minutes, freezes it. I've done it myself. It's very cool. And then once the fat cells have kind of atrophied or died off from the freezing, it's kind of like frostbite. Your body just absorbs it slowly over time.
Oh, okay.
Now, it's very important to, once again, lay down the results and expectations. This is minimal. So it's not for someone that's 200 pounds to do CoolSculpting forever. So
Okay.
How much does CoolSculpting cost? What's the range for that?
it's generally per area, and each area is about $750.
Okay.
So we've got 4 areas in the abdomen. That could be one kind of central area.
Would
That's
you do
generally-
that before doing the tummy tuck? Would that help?
I would do one or the other, just so we're not double spending. I would
Okay.
find out what you're a candidate for first, and then choose appropriately.
Okay.
Yeah.
Interesting.
Yeah.
This is like everybody's
favorite
favorite
part.
section of the pod, where people who listen to the pod get to
Perfect.
ask an expert question,
Yeah,
right?
love it.
Anonymously, right?
Yes.
But is there anything that we didn't
Yeah, did we
ask you
miss
that you wanted to share?
No, I'm just gonna tell all moms that you really deserve this, and don't feel guilty about proceeding with an abdominoplasty, because once again, you've sacrificed your body. This is a reconstruction in my mind. It's not vanity, and the benefits of physical benefits for it, as well as the confidence and all of that, I think you're just so entitled to doing it. And I would just say thank you, moms, in general. So, no.
All right, let's do Ask the Expert.
Yes.
Okay, I'm going to start with this one. I had 2 C-sections over 20 years ago.
Okay.
How should I prepare?
Ooh.
Wow. To prepare, again, just be in your tip-top shape. 2 C-sections is very common. Eat right and get to that healthy weight, and you should be good.
Okay.
Yeah.
Okay. This person asks, would a tummy tuck drastically change my body shape?
In my hands, absolutely. And what I mean by that is, once again, I'm trying to really restore that contouring. I want that hourglass shape. And that, again, is really, really important. So your body is going to go through a very tremendous transformation for the better.
Wow,
Absolutely.
that's great.
Yeah.
Okay, this
You'll
person.
love it.
I'm so excited.
I can tell. I'm so happy for you already.
Yes.
Okay, this person wants to know, could a tummy tuck improve the look of my abs?
Ooh, 6-pack, 12-pack?
So I'm not going to start with a 12-pack. I may start with a 2-pack.
Okay.
But one of the things I do in my contouring abdominoplasty I talked about is I throw in these internal quilting sutures, but I'm putting them specifically in the lines, as you see in a model where it kind of curves in on the sides.
Yeah.
So I'm contouring there. I'm also throwing contouring sutures down the midline. So I see that definition, and that's what's real important. So maybe not a 6-pack, but at least a 2-pack.
Oh, I'll take it.
I'll take a
Start with
2-pack.
Who wouldn't?
I've never had an any pack.
Oh, Dr. Park, you are delightful. Thank you
Yes.
so
Thank you.
much for joining us.
Here.
Appreciate
He's
it.
myth busting
So-
and he is schooling us
And
on
giving me my
all the-
consultation.
perfect, right here.
And she's ready to
For my tummy
go.
check. I am ready.
With CareCredit. Here
yes,
we go.
Yes,
Let's go.
exactly.
Thanks, Dr. Park.
Thank
Thank you very much.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube. Hey there, don't leave yet. Just wanted to say if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe.